But first, National Cabinet. First created by Scott Morrison during COVID, well, it met again today. It was meant to be better than its predecessor body, COAG, the Council of Australian Governments, but if anything, it's worse. It's fast become the place where tough decisions go to die, not to be solved. A roundabout, very apt in Canberra, of course, where a problem comes in and just goes around and around in circles as the politicians send it off for review after review with nothing much being decided, let alone fixed. It's a place where the states cry poor and everything becomes everyone's problem, meaning no one's got any actual responsibility to sort things out. But perhaps worst of all, it routinely lets underperforming state governments off the hook. Now, take health, which was on the agenda today. If there's a problem with Medicare, it's the job of the federal government to fix it, because Medicare is 100% a federal government responsibility. If there's a problem with public hospitals, it should be the relevant state government's job to fix it, because the hospitals are run by the states, not Canberra. But because the Commonwealth is on the hook for about 50% of public hospital funding, well, delinquent states always have a get out of jail free card, and they blame the feds. And sure, problems with Medicare impact public hospitals and vice versa, but in the end, we only get improvement if a particular level of government takes responsibility, makes a decision, allocates the funding, follows through and gets things done. As we saw during the pandemic, the National Cabinet is much better at making announcements than making a difference, just like today. They've billed it as the biggest Medicare reforms in 40 years. But all it was really was an agreement to endorse a discussion paper flagging more interdisciplinary care in general practice. Now, this was actually first started under the Howard government with care plans and rebates for allied health professionals, for patients with complex needs or significant mental health issues. Practice nurses, well, those rebates were introduced way back in the Howard government as well. As the AMA pointed out, there's absolutely nothing in today's announcement that would make a difference tomorrow. And with all of Labor's Medicare tweaks, there's always the fear that the fee-for-service principle will be eroded and that GPs will be turned into government employees rather than independent professionals, even though it's crystal clear what the problems are and equally clear how you would fix them. It's becoming harder and harder, as you well know, to see a GP. Now, that's because the rebates have been frozen for years. Whereas once something like 50% of medical graduates went into general practice, today it's scarcely 10%. And that's why so many practices have closed their books. It's why so many of our GPs are trained overseas. It's also a reality. A lot of GPs work part-time. So while the practice might have 6 doctors, that's not six doctors working Monday to Friday full-time. Today, the Prime Minister could have got the ball moving and announced that GP rebates would again be indexed. That doesn't involve the Premier's having to agree. That's him and his cabinet alone. It could have been done today, but it wasn't. The PM could also have announced that the rebate for a standard consultation would be increased, but he didn't do that either. He could have announced that the loadings for bulk billing children and pensioners and after-hours services would be increased. All Commonwealth government alone fixes that he didn't make. He could have announced that pharmacists would attract a Medicare rebate for relatively straightforward matters, such as renewing prescriptions for long-term medications, maybe for vaccinations as well. Now, that's a no-brainer to me. Nothing is more frustrating than have to get a GP appointment for a script to pick up medication you've been on for years and years. And if your GP doesn't bulk bill, like mine doesn't, well, I reckon you pay around $90 plus for the privilege of a script. If Anthony Albanese had announced these measures today instantly, well, there'd be less pressure on general practice tomorrow and more doctors happier in the service. Of course, something like this would have cost hundreds of millions of dollars. I don't make light of the spending, but unlike so much government money that they're throwing at bureaucracies, at least this spending would have generated real services for real patients. But again, the PM did none of this. Instead, he made an announcement that sounded much more significant than it was, but it was really just kicking the issue down the road. Indeed, the only actual thing this National Cabinet signed off today was yet another document pledging support for the voice.
Today, all First Ministers, in recognition of our commitment for constitutional recognition of Aboriginal and Torres Strait Islander peoples as Australia's first peoples, and also with a voice to Parliament being enshrined in our Constitution, re-signed, recommitted and signed up to a statement of intent.
That's not the PM there trying to save a failing health system. That's the PM trying to save his skin for a floundering referendum.